Powers, Nurse Manager of the Cancer Institute at the University of Maryland St. Joseph Medical Center. On behalf of our entire team, we would like to thank you for choosing us, and we would like to welcome you into our care. The purpose of this DVD is to discuss signs and symptoms that you may experience while you're receiving chemotherapy or biotherapy. We will also go over practical issues such as where to park, where we're located, and what resources we offer here at the Cancer Institute. We don't expect that you'll remember everything, and you don't need to write everything down. We do recommend, however, that you have a piece of paper and a pen available so that you can write down any questions that you have that come up during the presentation. Bring those questions with you to your next visit to ask your nurse practitioner, your nurse navigator, your physician, or your infusion nurse. We're here to answer your questions at any time. You'll also be receiving a personal treatment journal. This treatment journal will provide important written information that you can have at your fingertips to refer to at any time, including a copy of the presentation on the DVD. We recommend that you bring this journal with you to every visit so that you can add important information, such as educational sheets, test results, and lab results, and have everything at your fingertips in one place. Again, thank you for choosing us, and thank you for trusting us with your care. And without further ado, we present to you Chemotherapy Questions Answered.
Welcome to Chemotherapy Questions Answered. The purpose of this brief presentation is to give you an overview of what to expect during chemotherapy and biotherapy treatment. This course will not cover all issues that you may encounter. Always remember to call us with additional questions or any symptoms that you experience. We know that you may not remember everything that we say during the presentation, and that's okay. Your nurse navigator will provide you with a copy of the presentation in your binder that you can reference at any time. And remember, you can always call. With that, let's begin. So what is chemotherapy? Chemotherapy is a medication that is given in order to help attack the cancer cells in your body. So chemotherapy works by killing off rapidly dividing cells. So any cells in your body that are rapidly dividing are affected by chemotherapy. This is why we have side effects to chemotherapy, because we also have cells in our body on a regular basis that are rapidly dividing, like our skin, like our hair, like our GI tract. So that is why we experience some of the side effects that we experience from chemotherapy, meaning chemotherapy is not very specific. It works on any cancer cells and also affects our healthy cells as well. Hormonal therapy you may be receiving blocks the body's natural hormones. Mostly patients who are taking hormonal therapy have either breast cancer or prostate cancer. So you may never see hormonal therapy in your regimen. And then we get into biotherapy, which includes targeted therapies and immunotherapies. A lot of the newer drugs on the market are actually biotherapies. They're more targeted. They identify and attack specific cells or specific receptors on a cell that help to spare some of our healthy cells. The best way to kill the cancer is actually to do a combination of chemotherapy and biotherapy. Therefore, if the cancer that you have has a biotherapy that works against it, having a combination of both can be very helpful. So we're going to focus mostly in this presentation on the side effects of chemotherapy. Biotherapy, there are quite a few drugs out there, and they all have somewhat different side effects. So your nurse navigator will go over those specific side effects for your specific drugs. But we want to make sure that you do understand the more common side effects that happen with chemotherapy. And again, those are mostly related to the fact that chemotherapy affects our healthy cells that are rapidly dividing, as well as the cancer. So here are some side effects that you may experience, and we'll go into each in detail. Low blood cell counts. This is the most important part of the presentation for you to remember when we talk about the low blood cell counts. Fatigue. Almost everybody is going to experience some level of fatigue during chemotherapy and biotherapy treatment. It's very common. That fatigue will actually be worse if you're also receiving radiation therapy at the same time. So it's good to be prepared for that fatigue, and we'll go into that as well in specifics. Some nausea and vomiting. We've come a very long way with medications to help with nausea and vomiting during chemotherapy, but it still is a risk for some patients. hair loss, and that's with certain drugs. Not everybody loses their hair fully. Some have their hair thin, and some patients never lose their hair at all. So it's important to talk to your nurse navigator about which regimen you're receiving and whether or not that will cause hair full or partial hair loss. And then there's always a reaction when we take any medication, a chance that you may have an allergic reaction. So let's go into the first side effect that we'd like to talk about today. Myelosuppression is a fancy medical term that means low blood counts. So in our blood, we have multiple types of blood cells, and those blood cells help us with different things. We have red blood cells, which carry oxygen throughout our body. We have white blood cells, which help us to fight infection. And we have platelets, which help us to clot our blood. So those are the three main types of blood cells. And unfortunately, chemotherapy can affect any of those or all of those. So we will draw your blood very frequently. You'll have your blood drawn initially to get a baseline. You'll have your blood drawn at every chemotherapy treatment. And some of you may even have your blood drawn in between chemotherapy treatments to see how you are reacting to the medication. This is, I would say, the most serious side effect, and therefore we are very diligent in watching you and making sure that you're safe during this period. We also want to make sure that you understand some things that you can do at home to protect yourself as well from low blood cell counts. So the nadir, you'll hear us use that term at times, NADIR, is the point at which your cell count is at its lowest during chemotherapy. So you may think that's the day of and the day after treatment. That's actually not true. The nadir, the lowest point of our blood cells, happens about 7 to 14 days after chemotherapy treatment. So at about a week to 2 weeks after. So at this time, you are particularly at increased risk for infection, for bruising, for bleeding. You may feel more fatigued. You may have fevers. So the chemotherapy can decrease any of those cells. So let's talk a little bit about each one and what you should be monitoring for and what you may experience. So low white blood cell counts, you may also hear us call this neutropenia. So we may say your neutrophils are low today. Neutrophils are your body's first line, other than the skin, to infection. So we want to make sure that when those neutrophils are low, that you're aware and that we're aware so that we can help you to prevent infection. Because there are usually no signs or symptoms other than we notice it when we've drawn your blood. Again, not everybody will have that blood drawn in between treatments. Some treatments are more prone to causing neutropenia than others. So what do you do if we tell you that you are neutropenic? You need to prevent infection. The best way to do that is wash your hands often. So wash your hands very frequently. Check your temperature at least once a day, and you're going to let us know if your temperature goes above 100.4 or more, or if you have chills. You need to wash all of your fresh produce. So it used to be that we recommended you not eat fresh produce, but we actually do not recommend against that any longer. We just ask that you wash it all very well before you consume it. Have somebody else change the water for fresh flowers, or don't have them at all during your treatment. You can garden, but you need to wear some gloves, you need to wear a mask, long sleeves, and pants. You want to make sure when you're gardening there's risk for exposure to things such as fungus. So you want to make sure that you are covering up your nasal passages, covering up your arms, legs, to prevent cuts, things like that. If you have a cat, have somebody else change the litter or handle the feces. If you must do that, if you live alone and you don't have help, then make sure that you wear a mask and gloves. Some patients will receive what we call a white blood cell booster shot known as Neulasta. Neulasta is the most common. There's also another option called Neupogen. We tend to use Neulasta. Neulasta is given the day after chemotherapy to ensure that your white blood cell count does not go as low as it could. So it really helps to boost those white blood cells. Some patients do receive the the Neulasta or Neupogen and some do not. It all depends on your regimen and your treatment, and your doctor will let you know if you are to receive that or not. So let's move along to low red blood cells. So this is what we mean when we say somebody is anemic. When somebody has anemia, they have low red blood cells. And remember, red blood cells carry oxygen through our body. So when our red blood cells are low, we may have symptoms such as pale skin, fatigue. Fatigue is the most common. Shortness of breath, rapid heart rate or palpitations if the anemia gets severe enough, and you may get cold easily. So those are all symptoms of anemia. And so most of our patients will be anemic to some level. Very rarely does that go low enough to require something such as a blood transfusion. However, you need to keep an eye on this, and we'll keep an eye on it for you as well. You need to treat your symptoms by conserving your energy. Sometimes our clinic can be a little cold, so wear a sweater. We'll provide a blanket for you, and you can drink a warm beverage. That will be helpful with that cold. Iron supplements or a blood transfusion may be prescribed if needed. Again, that is more rare. However, some patients do require that. And then we also have a booster for red blood cells, just like we do with white blood cells, which is used pretty uncommonly. We don't use this very often, but it's known as Procrit, and it can be used during treatment to help keep those red blood cells up to an acceptable level. Again, we don't use that as much as we used to because we have found other ways to manage the anemia. So let's talk a little bit about low platelets. This is the last blood cell that we're going to talk about. And a low platelet count is also known as thrombocytopenia. So you may or may not experience symptoms from thrombocytopenia. If it's low enough, you may experience some bruising, some nosebleeds, maybe some bleeding when you brush your teeth with your gums. You want to let us know if you start to notice that. Any blood in your urine, in your stool, or if you have a wound or cut that won't heal, that's particularly concerning, and we would want to know that right away. So how can you protect yourself when your platelets are low? We don't do much for low platelets, meaning unless the platelets are extremely low, you do not get a platelet transfusion. So you need to make sure when your platelets are low that you're preventing injury. Wear proper footwear, meaning wear rubber-soled shoes that you won't slip or cut your feet, and reduce clutter at home. So get rid of those throw rugs and things that could trip you. Avoid medications that can increase bleeding. So if you're on a daily baby aspirin, please talk to your medical oncologist to make sure they want you to stay on that. Ibuprofen or other NSAIDs such as Aleve can thin the blood as well. So again, ask your doctor about taking these medications and if you should avoid them. You need to ask your doctor prior to scheduling any dental appointment, and that goes for any chemotherapy patient. So because our platelets are low, because your white blood cell count is low, dental work can be particularly risky, so we want to ensure that we're aware of what you're going for, and you may want to have a dental cleaning prior to starting chemotherapy. Make sure to report any significant bleeding, as was stated, or severe headaches. So if you have a headache that it's like something you've never felt before in your life, you definitely want to let us know while you're on chemotherapy. So that is the last piece on low blood cells. I know that that's quite a bit to take in, but it is important, and make sure that you have those slides to reference in your binder. Let's talk about fatigue. So fatigue is the most common and the most distressing complaint associated with cancer and cancer treatment. Not everybody will have it, but most patients will. And we will ask you each time you visit, what's your energy level been? How tired have you been? Have you felt fatigued? There is a fatigue scale from 0 to 10. 0 meaning that you're fine, you're out, you're running, you're doing your normal activity. 10 meaning that you can't get out of bed all day. And we'll need to manage your treatment against your quality of life. So if the fatigue is affecting your quality of life and your ability to live the way that you want to, we'll have to discuss that, with each treatment and see how you're doing. So what can you do to manage fatigue? Prioritize your day by doing your most important chores or errands when you feel the most energetic. So if you feel the best when you wake up in the morning, do everything in the morning. And then by the evening, when you're feeling fatigued and tired, you can rest. Conserve your energy by taking short power naps. So less than an hour is usually what we recommend during the day. Exercise each day, even if it's just a short walk. This does help with fatigue. I know it sounds counterintuitive, but it's very helpful to try to get up and around, even if it's just for a short time. Now, if you're having shortness of breath or heart palpitations during even moderate or mild activity, please let us know. We want you to drink at least 64 ounces of fluids a day. Those fluids can be anything, juice, water. We prefer non-caffeinated. So anything that you drink caffeinated, such as coffee or tea, does not count towards your 64 ounces. However, if you're not feeling well that day, don't push fluids in. Meaning if you can only get 50 in, only 40 in, that's fine. Delegate to others. You don't have to do everything yourself. And I think that's hard sometimes for all of us to remember that we don't have to do it all on our own, that we can ask for help, and that's okay. So let's talk a little bit about nausea and vomiting. As I said before, we typically are able to manage any nausea and vomiting very well with medications that we have. So remember that chemotherapy affects our GI tract, and so we can have some nausea and some vomiting. So anti-nausea medications will be prescribed to you based on your chemotherapy regimen, since each chemotherapy drug is different. So not every chemotherapy drug causes the same level of nausea or vomiting. Anti-nausea medications will be given to you prior to your chemotherapy here at the infusion center, and those are called pre-medications. So when your nurse says she's giving you pre-medications, that will include some medication for nausea or vomiting. Anti-nausea medications will also be prescribed for you to take at home if needed. So you will get them here, and then you'll have some at home to take if you need them in between treatments. So what's the best way to manage nausea and vomiting? Don't wait to take your home anti-nausea medication. If you wait until you're actually vomiting, it'll be difficult to keep the pill down. So make sure at the slightest hint of nausea, especially the first couple of days after chemo, to take that anti-nausea medication per the instructions that you received from your nurse navigator. You can try things like hard candy. Ginger, peppermint, or cinnamon can be very helpful. Distraction can be helpful. Listen to some music, read a book, watch some TV, or do a favorite hobby. Avoid strong odors. Be aware of your increased sensitivity to these smells, and try to stay away from things that bother you most. You may have some changes in taste, and you may have a metallic taste that can affect your ability to eat as well. So we have a dietitian here that is able to talk to you for more ideas and help if you need it. Okay, so nutrition. We just talked about nausea and vomiting. Of course, when you're feeling nauseous or you have taste changes and you're just not feeling well, it can be very difficult to maintain proper nutrition. During cancer treatment, it is critical to attempt to maintain your nutrition status. During treatment, you may gain or lose weight. Patients with breast cancer sometimes gain weight. Patients with lung cancer tend to lose weight. So it depends on your particular circumstance and your disease. You want to avoid empty calories like chips and candy. So you want to take in the foods that you can get in. You want to make sure they're nice and high in protein and vitamins and minerals so that every bite that you are able to take means something. Eat a high protein diet. Nuts, cheeses, milk is high in protein, meat is high in protein, chicken, fish, and try to get some of those items in your diet. We have a dietitian again that we can call for ideas and help. You can use supplements if you're not getting enough calories. So if you're not able to take in enough food and you're not getting enough calories on your own, talk to your nurse practitioner or your physician about starting something like Ensure, Boost, or Juven. You can also add those two ingredients like fruit, yogurt. You can get protein powder and ice cream to up your calories. If you're not able to eat big meals, it's okay to graze all day, eating small meals every couple of hours. So hair loss. Again, we talked about this earlier that not every patient will experience hair loss fully or even partially. You may hear us call hair loss alopecia. Not all chemo causes hair loss. You may just have some thinning. So it happens about 2 weeks after therapy starts, but again, it's very different for every patient. And then everybody always asks, when will my hair regrow? Takes about 3 to 5 weeks after the end of treatment for it to start, and full regrowth may take about 3 to 5 months. You may find your hair is a little different in color and texture as well when it grows back. So how do we manage hair loss? You want to make sure that you protect your scalp from the cold and the sun. Your scalp is not used to seeing the elements, so it can very easily get sunburnt, windburnt. So please make sure that you're protecting your scalp using either a head covering, a head scarf, a wig, or a hat. Don't dye your hair during therapy or for about a year after finishing therapy. The hair can be very brittle and delicate, so you want to make sure to maximize that hair regrowth, that you kind of try not to chemically alter it in any way for about a year. Your scalp might feel sore and sensitive, so right before the hair falls out, some patients say they feel tingling in the scalp. Some say their scalp feels sore, and that is a normal feeling. And it's always important to look for a wig before hair loss, meaning don't wait until your hair has totally fallen out and then try to find a wig. Sometimes it can be a bit of a process to find a wig that fits, to find something that you like, and then sometimes insurance will cover it, and that process can be long. So it's important to start that process before you actually lose all of your hair. So allergic reaction, this can sound scary, but we always like to make sure that we let every patient know that this is something that can happen, so that you know to let us know right away if you're experiencing anything that doesn't feel right. So what is an allergic reaction? It's the natural reaction of our body to something that just doesn't belong. So, you may have an allergy to penicillin. You may have an allergy to bee stings. Those are some common allergic reactions. So anytime we're introducing something foreign into the body, there's a chance that your body may not like it and may react to it. So it's the same thing for chemotherapy. There are some drugs that our body doesn't like more than others, and we'll let you know during your treatment if the medication that you are receiving has a high risk for reaction. And we will monitor you extremely closely. You are in view of a nurse at all times when you're receiving your treatment, and you may actually want to let us know anytime that you feel something that just doesn't feel right, even if it's just a gut feeling where something doesn't feel right while you're getting your infusion. So some symptoms that may be a sign of an allergic reaction: difficulty breathing, chills, itching, rash, hives, and again, report any odd sensations to your nurse. It's very important. So there are some other side effects you may experience. We won't go into all of them in detail because not every patient has them. But some patients do have flu-like symptoms, meaning joint and muscle aches, just feeling down, feeling almost flu-like. Constipation and diarrhea can happen with medications. Neuropathy, that's numbness and tingling of the hands and feet. If the medication that you are receiving puts you at a high risk for neuropathy, you will receive those instructions from your nurse practitioner, your nurse navigator, and your infusion nurse to let us know every time you come in for treatment if your hands or feet are tingling or numb, or if you lose any ability to do any function like buttoning your shirt. We'll want to know that right away. Some treatments can cause tenderness of the mouth or mouth sores, so we'll look into your mouth to make sure that there aren't any issues there. Again, changes in taste. Things might taste bad or metallic, especially with certain medications. You may experience changes in your nails, in your skin color, or the tone of your skin. Of course, a lot of patients do feel a sense of sadness or fear or a sense of loss, of normalcy. You're coming in to see us very frequently. You're losing your hair. You're feeling side effects. It's sometimes all very difficult to cope with. You may have some depression or some anxiety. We do have nurses who are trained in how to help with that. And we also have a social worker here who's available for individualized counseling as well. So you can always ask your nurse about that. So you will have a side effect section in your binder. You can refer to that or this presentation at any time, or talk to your nurse practitioner, your nurse navigator, or your physician or your infusion nurse anytime you have a side effect that you need help managing. Make sure to get your prescriptions filled. So do not wait until the day of chemo or the week after to get those prescriptions filled to see if you need them. If you need them, you're going to need them quickly, and you don't want to have to be waiting for them to get filled. So we highly recommend that you have all those medications that were prescribed to you on hand at home before starting treatment. Some common over-the-counter medications you may want to have at home: Imodium in case you get diarrhea. Colace is a stool softener, and Senna is a laxative, and we actually typically recommend Miralax now rather than the Colace and Senna together. So have some Miralax at home if you tend to get constipated. Benadryl, have Benadryl at home. Catch and manage those symptoms early, so don't be afraid to call us and let us know if you're not feeling well. We're going to switch gears just a little bit and talk a little bit about Chemo Brain. So what is Chemo Brain? Chemo Brain is a forgetfulness or a mental fog that some patients experience during chemotherapy. So there are some cognitive changes during chemo that can cause difficulty concentrating, working with numbers, and or multitasking. It's more common among people being treated for breast, lymphoma, lung, and testicular cancers. So what can you do? Write things down in a notebook or on a calendar. Read, do crossword puzzles or other word puzzle activities to work your brain. Follow a routine, ask for help, try to relax and reduce stress, and bring someone with you if you need help to take notes when needed. Intimacy. Remember, cancer is not contagious. You do need to avoid pregnancy, but sexual intercourse is permitted with protection. Affection is always important. Make sure to focus on the positive and be patient with yourself and your partner. If you have any questions about intimacy, ask your nurse navigator or our social worker who can help you through some of those issues. So what do you need to do after chemotherapy to protect yourself and your family? For the first 48 hours after chemo, your body fluids will contain very small traces, and that may be found in urine, stool, emesis, which is vomit, semen, and vaginal secretions. If any body fluids spill onto clothes or linens, they should be laundered separately, but you don't need to launder your clothes separately on a regular basis, only if there's urine or vomit should they be done separately. You can double flush the toilet with the lid down for the first 48 hours and use protection during sexual activity. So what do you need to call us for? These are the things that you need to call us at 410-427-5585 if you experience a temperature of 100.4 or greater, shaking chills, significant bleeding, bruising, significant change in symptoms, meaning pain that's increasing, a rash that's increasing, vomiting that's not controlled by home medications, diarrhea that's not decreased with home medications, any pain or burning with urination or frequent urination, or an admission to the ER or hospital for any reason. So what happens when you call that number? This number can be used 24 hours a day and 7 days a week, so even in the evenings and on the weekends. Monday through Friday from 8 a.m. to 4:30 p.m., our telephone receptionist will take your call and send a message to our triage nurses, who will call you back by the end of the business day. For urgent calls, if you're feeling sick, you should expect a call back within an hour. Please be very specific with the telephone receptionist about what you're calling for so that we can make sure we triage your call appropriately. After business hours, your call will be taken by an answering service asking for your name and your oncologist, and the on-call oncologist will return your call. If you do not receive a call back within 15 minutes, call back. It's important to note that we require at least 48 hours notice for all prescription refills, so please call us in plenty of time before you run out of medication. You can call anytime you have a question or a concern regarding your home medications, your side effects, or your treatment. You can call your nurse navigator whenever you have a non-urgent question. You need to call 911 if you're having chest pain, extreme shortness of breath, difficulty breathing, or anytime you would call 911 even if you were not being treated for cancer. So what do you need to do for chemotherapy day 1? Get a good night's rest. Take any of the pre-medications that were prescribed to you. Some of you will be prescribed steroids the day before and the day of treatment. Eat a light breakfast or lunch. Please don't come on an empty stomach. And bring someone with you who can drive you home or arrange for transportation. You do not want to be driving on your first treatment. You just don't know how you'll react to the medications. When you come into the infusion center, you'll register at one of the front desks. An infusion staff member will call you and walk you back. And your vital signs, your height, and your weight will be taken. We will ask you to take your shoes off. The height and the weight are critical when we're looking at your chemotherapy dose. Your port will be accessed or an IV will be placed, and blood work will be drawn at this time and sent to the main lab. The infusion nurse will review all of your home medications and medical history, so bring a copy of your current home medications with you. And when your lab results are back, the nurse will review them, order your chemotherapy, and give you any pre-medications ordered. Your length of treatment depends on the chemotherapy you are receiving. But please remember that the lab work, the pre-medications, and the mixing of the medication takes about 2 hours on top of the length of time the chemotherapy is infusing. So if your physician tells you the chemotherapy takes 2 hours, plan to be here about 4 hours. Some of our policies. Children under 12 are not routinely permitted, but they may tour the infusion center with advance notice. There's a maximum of 2 visitors with you at any time. There's just not enough room for more than 2. If you will be at the center for lunch, please bring a lunch with you. We do have drinks and we do have snacks, but we do not provide a meal. For radiation patients only, outside parking is available behind the Cancer Institute. All other oncology patients are to park in the O'Day garage next to the Cancer Institute. There are special parking passes, including daily and booklet options, that can be purchased for a fee at the parking booth as you exit. And we unfortunately do not validate parking at the center, so you must purchase one of the special parking options for any discounted parking. Very briefly, I want to let you know about something that you will see when you come into the office. We will be doing a distress thermometer with you. We will ask you to rate your distress on a scale of 0 to 10 at every visit, and depending on that score, we will enlist one or more of our support services to help you. And this is what the distress thermometer looks like. We'll ask you about family problems, practical problems, emotional problems, and depending on what your score is, may need to get some services together to help you. Our support services include our nurse navigators, who serve as a liaison between you and your Cancer Institute care team and do patient and family education and support groups. We have a survivorship program to transition to life after cancer, and we have a social worker who can provide psychosocial support, including support groups, links to community resources, and brief counseling to help with decision making. We also have a genetics counselor, a dietitian, pastoral care, and a patient library located on the ground floor, offering free resources, books, and the internet. You may be eligible for clinical trials, so ask your physician if that's something you may be interested. We have them available for many disease types, and it may be a treatment option that is discussed with you. It helps to improve progress in cancer treatment and survival, so talk to your doctor about more information. Do you know your rights? When you register, you will receive a form that describes your rights as a patient. You can also find this form displayed at our registration desk and in your chemo binder. So please review this form, and if you have any questions, please talk to your nurse or physician. Please don't hesitate to ask any questions you may have from this presentation to your chemotherapy nurse, nurse navigator, or your physician. Thanks.